Side.
Brilliant. Thank you so much. Well, thank you so much to everyone who's joined. It's really exciting to have you here today, and we're really excited to talk you through some of the findings that we've had from over the last 4 or 5 months from a pipeline simulation program. I'll pass on a bit later to the Satellite Applications Catapult team to talk through what the pipeline simulation activity is. But what we're hoping to talk you through today is we've done a series of interviews and workshops to try to understand what the challenges are with enabling connectivity and operationalizing One Health within the Indian health context, and to identify opportunities for space-enabled solutions to address some of those challenges. And so today we'll have a series of introductions from the different collaborators on this project, to include our funders, UK Research and Innovation, Innovate UK, Foreign Commonwealth and Development Office, Public, and the One Health Antibiotic Stewardship in Society as part of LSHTM, and of course the Satellite Application Catapult. And then we'll go into a series of descriptions of what the challenges are that have been identified, and what potential opportunities and solutions are. And we've got what I'm most excited about, a series of showcases from organizations who have solutions in this space, and who will talk through what their solutions are and also how that could be applied within the Indian health context. If we go on to the next slide, please, Modular. Just a few housekeeping points before we get started going with today's session. You should have received a pre-event survey, and after the event, you'll receive a post-event survey. So please do complete that if you've got the chance. Hopefully, it should only take about 5 minutes to do, and it really helps us to understand and to include in our recommendations the amount of engagement or remaining questions that are around these different topics that we're talking about. If you've got any questions during the session, please do put them in the chat. We'll aim to answer them at the end of the event, or post the event if we don't have the time to do that. This event will be recorded, and so I think the recording's already started, and we'll make the recording available to everyone post-event. Likewise, if you'd like to have the slides, please do request them, and subject to agreement with the different organizations, we'll make sure that we can share them post the event as well. A quick note to say, we're talking about space-enabled solutions, and one of the great solutions in this space is that we know we can forecast the weather. And so we do know that there is a storm coming for those of you in the UK. If there are any troubles with connectivity, there are several panelists on the call, so hopefully we can make it through the whole session without being disrupted. But as I mentioned before, the session is recorded, and so everything will be made available to others offline afterwards if you do have any problems throughout this session. And finally, if we jump onto timings when we're on the next slide, we've got a packed session today. As I mentioned, we've got about half an hour of introductions from the different government agencies involved in this, just explaining why this is such an important topic for each of the different departments. And then we'll get into a series of presentations about what the challenges were that were identified during our interviews and workshops, and different businesses who can showcase their solutions in this space before we can close off with discussing the next steps. So that's it from me at this point. You will hear more from me a bit later. But I'm going to pass on to Daniel Rothberg from FCDO to talk about the importance of this activity for the FCDO in India.
Brilliant. Well, thank you. Thank you for that, Louis. And good morning and good afternoon, wherever you are at the moment. And thank you for your time today. My name is Danny, and I'm the Deputy Head of the Science Team here at the British High Commission in India. And let me first introduce you to what the science team here does. Next slide, please. We facilitate collaboration between research centres and universities in the UK and India. And we also connect innovative UK expertise with international opportunities. As part of this, we work very closely with UK Research and Innovation, who are a public body sponsored by the Department for Business, Energy and Industrial Strategy, and most excitingly, the UK's biggest public funder of innovation. And in India, those innovation opportunities are vast. My colleagues and I work on fields as diverse as health, agri-tech, and the fourth industrial revolution. But most excitingly, I lead on space. India is a space superpower, and HM government have funded the Catapult over the last couple of years to look at the satellite applications in more granular detail and help build the UK-India bilateral relationship on space. The future of this relationship will be shaped not just in our respective countries, but in the cosmos as well. And India has a proud and innovative history when it comes to space exploration, since the launch of their first sounding rocket in 1963. And the UK home to Stephen Hawking and Jodrell Bank, amongst others, is India's natural partner. And this is something both Prime Ministers highlighted in the 2030 roadmap for India-UK relations last year. Momentum is building. In 2021, last year, the UK launched a groundbreaking space strategy, and we also held the inaugural UK-India space consultations. The pace increases into 2022, with 2 commercial spaceports opening in the UK. Ultimately, space plays a critical role in our daily lives. Satellites orbiting in the Earth above our heads keep us connected. They support our security and prosperity, enabling us to navigate the oceans, keep our troops safe, and monitor the weather, which is obviously very important right now. The space sector is also a vital part of the UK economy, worth over £16.4 billion a year. It employs over 45,000 people. And the global space economy more generally is projected to grow from an estimated 270 billion from about 3 years ago to 490 billion by 2030. The Prime Minister, Boris Johnson, challenged us to turn global Britain into galactic Britain. Your conclusions from this project will help secure this. Thank you again. Back to you, Louis.
Thanks so much, Danny. I'm actually going to have the pleasure of handing over to John from the Satellite Application Catapult to talk about the work that the Catapult does in health.
Thanks, Louis, and thanks, Danny, as well. So I just wanted to give an overview of the Catapult and where my role sits within that. So if we could go to the next slide, that'd be great. So Catapult's mission, we're a not-for-profit research technology organisation, and our mission is to innovate for a better world empowered by satellites. And for me, translating that into health and well-being is about how do we collaborate with partners both in the UK and in places like India to bring great care closer to home, closer to the individual. So what we want to do and what we try and encourage organisations to come together around is how do we spend time thinking like a health system or a social care system, but also work with and act like an entrepreneur. So whether that's doing things like co-design, risk opportunity analysis of what the different systems could do differently, or it's in terms of prototyping and trialing with partners, some of which you'll hear from, as Louis said, later on today. And fundamentally, my responsibility is recognising that satellites are an option of how do we support ubiquitous connectivity, delivering, in my case, health access and health equity, and how is geospatial intelligence there to support enhancing care options. Now, there are colleagues of mine, a bit similar to how Danny described his colleagues, that take those 2 technology offers of ubiquitous connectivity and geospatial intelligence into other market areas, whether transport and logistics, agriculture, sustainable finance, or others. And I'm sure if you wanted to reach out to the Catapult, we'd happily talk to you about those areas too. But for now, I just wanted to hand over to my colleague Patrick to talk a bit about the programme that we're working on and discussing today.
Thanks, John. Thanks, Manoa. So I'm just going to go over and give a bit of context to what we've been up to working in India with the Foreign Commonwealth Office, Innovate UK, DIT colleagues, both here in the UK and in India. So good morning, good afternoon. As John said, my name is Patrick Stewart. I've been working at Catapult for just over 3 years, and I'm an international business analyst, and I lead on the Catapult's international discovery exercise known as the Pipeline Stimulation Programme. So the Catapult's Pipeline Stimulation Programme, PSP, is a series of international activities designed to identify those long-term strategic opportunities for innovation and impactful collaboration globally. These activities encompass discovery exercises to identify opportunities, be it commercial, research, or academic, that could be addressed through joint UK international collaboration to deliver prospects for UK organisations. In each of these activities, we do a number of things. So last year, at the beginning of last year, we started off with what's called a phase 1 pipeline stimulation activity, and that was funded by BAYS and sponsored by FCDO. And in this phase 1, it's designed to identify the themes of interest within certain topics. In this instance, we looked at agriculture and health. And we undertake interviews and desk research with in-country stakeholders to understand what application areas are of importance in a specific market. In phase 2, which is currently where we are now, we look to significantly step up our activity and begin to validate those opportunity areas. And we do this by undertaking workshops with stakeholders, more specifically your sort of smallholder farmers or your pharmaceutical companies or health providers, your ministries of state, etc., in order to identify those really granular opportunities. Who has that problem and what can we do to try and start addressing that? We then host a bilateral event, this event that we're conducting today, to present our findings back to the UK and the respective market, so that you can start to better understand what opportunities exist in country and to see how we can engage with them. So following this event, we'll be sending out a post-event survey to gauge your interest in these areas that we're going to be discussing today. And this will help us to build that roadmap of engagement and activities for the next 12, 24, 36 months and beyond, which will then hopefully lead into that phase 3 of post-discovery, where we can support in-country engagement and start to kick off activities in earnest that include both UK and Indian organisations through projects and new programmes of delivery. So in summary, the aim of the PSP is to identify the opportunity areas for UK engagement and collaboration, to generate awareness of areas for complementary and positive interactions, to enhance the visibility of stakeholders and states in country where we need to focus our efforts, and to improve visibility of the key supply chain and sector needs. So if after this event you want to know more about the pipeline stimulation program and how we can work with you internationally and in India, please do reach out. But for now, I'm going to hand over to our colleagues at DIT to overview their activities and the importance of gauging in India. So I hope you enjoyed today's session and thank you for joining.
Thanks, everyone. So my name is Rahul Agrawal. I'm Deputy Head for Healthcare and Life Sciences at the Department for International Trade. If we could go to the next slide. So as part of UK government, DIT supports UK organisations to do more business overseas. And we also attract investors back home in the form of FDI. So we support every type of UK organisation looking to trade overseas. And this includes the space of technology, healthcare, life sciences, and such. And I'm going to give you a bit of an overview of health tech for UK and India. If we could go to the next slide. So the first message I want to give you is about the importance and acceleration of our economic relationship with India. As part of an integrated review of security, defense, development, and foreign policy, the UK wants to deepen its engagement with the Indo-Pacific. And this is the case in economic terms as well, with India being one of the most dynamic and fast-growing economies at the heart of the Indo-Pacific. Our bilateral trade in 2019 was £23 billion, and we at DIT are exploring a future free trade agreement with India, which also includes UK market access for all sectors, including healthcare, life sciences, and technology. Prime Ministers Modi and Johnson committed to an enhanced trade partnership, which looks to double trade by 2030, strengthening our relationship and invigorating our respective economies through an FTA. And this enhanced trade partnership is part of a wider 2030 roadmap, which covers a full spectrum of UK-India bilateral relationship. And, you know, in this case, India's digital transition presents a great opportunity for the UK and its digital sector. You know, it aims to be $1 trillion online economy by 2025. And this presents a really good opportunity for UK companies, including SMEs. And as such, the UK also wants to build on our valuable relationship between UK and India in healthcare and life sciences. And in fact, the 2030 roadmap for India-UK future relations says that as a global force for good and health, the UK and India will use our combined research and innovation strength to address the biggest global health challenges, to save lives and improve health and well-being. Both countries face considerable challenge of rising demand and expectations, and there's an increasingly urgent need to innovate together to meet these challenges when our populations are growing, they're aging, and also because of the consequences of non-communicable diseases like obesity, the impact of pollution, and demand for a skilled workforce, which you know, globally outstrips supply. If we could go to the next slide. So focusing a bit more on health technology in the context of connectivity and One Health, there are a couple of key points to share. I mean, firstly, the UK puts digital health at the heart of our NHS system. The NHS's strategy puts patient empowerment and digital technology in terms of responding to the pressures of the system. So our system itself is looking to transform everything we do towards technology because we want faster, better quality, safer and innovative ways of caring and better informed patients. So organizations like NHS Digital and NHSX, they're combining talent, industry, government, and the NHS to drive benefits of modern technology to every patient and clinician. So when you look at our system, the real strengths of our UK system in terms of connectivity include managing virtual pathways, tackling loneliness and isolation, remote monitoring, digital therapeutics, and self-care, remote consultation, and companion apps. These are sort of the key areas that the UK is looking in our system in terms of connectivity and technology. And it's also important to look at a One Health approach when we're looking at linkages between multiple disciplines. So when you look at the case of the post-pandemic world, we are looking at how technology can help us work at a local, national, regional, and increasingly global level. And we also are trying to combine human, animal, and environmental health. So this is what the UK government is also looking at, including the NHS. And this requires a lot of collaboration, obviously, between different sectors, whether it's private, academic, and public. And this is the essence of global health. Global health transcends boundaries. And what we're doing in the NHS and the UK system is something that we want to share overseas and vice versa. I mean, examples include genomics, biotech, agritech, and obviously digital health, which I've just mentioned. And the UK has a really fantastic life sciences ecosystem. It tries to foster these collaborations. And, we want to try and build a sort of global resilient sort of atmosphere where human health is safer, the UK is more prosperous, and we're also achieving SDG 3 when it comes to world sort of development. So yeah, as I said, collaboration is key to UK and India. And both countries have very innovative sectors. For instance, some of the opportunities in India we're seeing in health tech include remote monitoring, which delivers better care in dense urban environments and remote rural areas. We're looking at opportunities around quality data, digital ways to deliver clinical education, applying future tech like AI and robotics, and wide opportunities in biotech and health system strengthening, such as primary care. So these are the areas that I would really look at when I'm looking at India and UK collaboration. And then final slide. Yeah, and then finally, I just want to leave you with a bit of a summary of some of the key messages. India healthcare sector is projected to grow to $372 billion by 2022. And the market is growing in health tech in India by 27% annually to 2024. And some of the opportunities in India I've already mentioned, but I've just summarized again. They really revolve around three major areas: digital health, medtech, diagnostics and medical devices, and then biotech, areas like genomics, drug discovery, digital therapeutics. And then finally, the UK itself has a really good, strong sector in digital health and health tech. And we at DIT have actually published a Beyond 100 Digital Health Playbook, which markets the UK companies in the space. We have about 120 organizations in there. And I think one of the presenters today, Spirit Health, is actually part of that. So, we're happy to support SMEs and organizations as they explore overseas, including in India. And, I'm happy to talk more about this, and we will share the slides obviously after this. And thank you for the opportunity to speak today. Thank you.
Thanks so much, Raoul. So I realized I spoke before, but I didn't actually have the opportunity to introduce Publix. And if you wouldn't mind moving on to the next slide, I'm just going to give a quick introduction to myself and the context of this work. So Patrick gave a great description of the pipeline simulation activity earlier, and Publix has been supporting in the facilitation of that over the course of the last few months for the UK-India pipeline simulation activity. If we move on to the next slide, our mission is to help public sector bodies to transform the services they offer in order to create a better society for everyone. And we drive this largely through leveraging technology and supporting government to identify what technology is available, what the gaps and challenges are, and to map the two together in order to have work across policy all the way through to the product that enables that policy to be implemented. If you wouldn't mind going to the next slide, Manuel. So who are we? Raoul mentioned before the importance of collaboration. I think this is really key to me. The way that we've structured Public is that we've got expertise across different sectors, ranging from procurement, privacy, security and safety, and climate and health. And whilst these sectors are fantastic by themselves, they're actually facilitated by a series of capabilities, which include data services, workforce transformation, challenge programs to identify challenges and how they can be addressed by technology. And so what's really key to me about the work that we do at Public is that, yes, we've got these sectors that we work in, but actually it's this intersectoral collaboration about how do you bring in all the right stakeholders and the knowledge across sectors to deliver upon the different solutions that are required. I think One Health and connectivity is a great space in which this is applied. And for us, it's been really exciting to work on this and to work alongside a bunch of fantastic collaborators on this topic as well, to show the strength of collaboration and driving this forward. Next slide, please, Manuel. So what do we do and how do we deliver upon our mission? There are three key areas of Public. We advise governments and public bodies and partners who are seeking to digitally innovate the services and systems. We build technology products and services to transform the public sector. And we convene innovators, policymakers and investors together to explore and shape the best future of public services. And if we go to the final slide for me in this quick introduction, we do this with a range of partners across government, but the kind of work that we do and what this looks like into your day-to-day is through transformation, helping to product and policy teams integrate emerging technologies within their new service models, challenge programs where we look to identify what the major challenges are and how they could be solved by digital solutions, learning programs helping product and policy teams to integrate emerging technologies within their new service and understand what are the skills that you require in order to do that sustainably. And we've got a GovStart program, which helps identify and grow innovative companies who are working to solve public sector problems in this space. I'm going to pass over to our colleague as well, Meenakshi, very quickly to give an introduction. We've been working very closely with Meenakshi from the London School of Applied Tropical Medicine and the OASIS program on this project. And so I'd love Meenakshi to have the opportunity just to introduce very quickly what they do as well, before we dive into talking about the challenges and solutions that have been identified.
Hi, thanks, Louis. So my name is Meenakshi Gautam, and I am a health policy and systems researcher at the London School of Hygiene and Tropical Medicine. I live across the UK and India. A lot of my work is in India, and it focuses on One Health. So I lead this project called OASIS, which stands for One Health Antibiotic Stewardship in Society. We have a number of partners from the UK and India, all academic partners led by LSHTM. We have the Public Health Foundation of India. We have the Royal Veterinary College here, providing veterinary expertise. We have a West Bengal University of Animal Sciences, and we have the Institute of Development Studies. So a whole range of interdisciplinary partners. And my own expertise is in interdisciplinary research, which I love. So that is why One Health, which requires a lot of cross-sectoral collaborations and working together. And I will talk a little bit more about this work later when I come to my presentation. Louis, would that be okay?
That's perfect. Thanks, Meenakshi. So we're going to dive into the section of this presentation now where we talk about the different challenges that were identified through a series of interviews and workshops, and then dive into what the different solutions are that address those challenges and to showcase some organizations who are working on those. So if we go to the next slide, I'm going to be talking about the theme of enabling connectivity. And next slide again, please. I think people have seen enough of my face already. So what are the three different areas of connectivity? So what is connectivity? Well, firstly, connectivity is really important and underpins how we connect doctors and patients within the system. And it relies on interoperability between different services across health systems and near zero latency in order to be able to deliver improved care and quality of care for patients, equity of access of care, and speed of care in a growing and aging population where there is increasing demand on healthcare and healthcare services. We've all seen how important it is during COVID globally, and it's really enabled us to deliver services remotely to patients when patients weren't able to see the doctors or other care providers in person. However, it does have a particular relevance within the Indian context where there's been historically quite a challenge of engaging public, private and informal care providers together to work together and connecting up the way that patients receive care from these different providers, and making sure that patients are being able to access the relevant care across the board. And so there's a real particular challenge there about how do you connect up your public, private, and informal services. That connected services and internet connectivity really does enable in this space. Within the Indian context as well, you've got a population of nearing 1.4 billion today. And one of the key things that unites and enables the care providers to access this population is mobile phones, which is widespread throughout India. I think there's 1.2 billion mobile phones in India for the 1.4 billion population. And so it's really a key driver of how people can access services in their day-to-day life. And more, especially with the changes that have happened during COVID, they've been a key enabler of accessing connected care services within the Indian context. And that's been promoted by the Digital India campaign. And finally, the historic infrastructure inequalities for healthcare across the Indian context, where the majority of healthcare infrastructure has been located within urban areas, despite 60 to 70% of the population living in rural areas, which has limited the access of rural populations to the range of care services that are available. And so connectivity is really key within this context of a great solution to be able to begin to improve the care and access to care of a growing population. And what's the role of space? Well, there's several elements to connectivity. There's clearly the element of data processing and collecting data and being able to analyze that data to be able to improve the services we provide. There's an element about being able to redesign your care pathway solutions to ease the pain points. But spaces and satellite connectivity is a real enabler in this space, because it enables you to have a secure, reliable, wired or wireless network to connect your services. And it allows you to use cloud tech with low latency to be able to do this really rapidly. And so over the last 5 to 10 years, we've really seen this as an emerging enabler, which has sped up the pace at which healthcare systems have been able to connect and improve the quality of care that patients have been able to receive. Next slide, please. So there are 4 key challenges we want to draw out today that emerged from our different interviews and workshops with stakeholders in India. The first is the challenge of poor internet network in rural and mountainous areas. And this is a huge challenge where the majority of the population lives in rural areas. However, there are areas which are really hard to reach in terms of network connectivity. So the challenge is, how can you deliver specialist medical services to hard to reach communities where there is this poor internet network? There are a few potential solutions in this space. One of those is using drones to deliver health services and medications where that connectivity is possible. There's another solution around using enhanced networks. And so how can you enhance the ubiquitous connectivity networks so that actually you can access and improve the network connectivity in those remote areas? And finally, there is a question about, how do you target the interventions that you do to the relevant stakeholders? And so in this case, when we're talking about these rural mountainous areas, Meenakshi will speak much better than I will about this, but the majority of care provision is through your parahealth workers who are connected themselves to medically trained clinicians who can support them in the work they do. And so how can you target any intervention that you do to increase the connectivity and the enhanced networks at the relevant medical personnel in those communities who are responsible for delivering the care to those communities at the moment, to make the most of that and make sure that they have the relevant connectivity, which then enables you to access these hard to reach populations. And so there's a series of different interesting interventions there, and we'll hear from some colleagues afterwards about the solutions that they've got in this space that could enable that. But there are elements of technical products and solutions, but also understanding the behavioral and cultural trends, which then enable you to access the relevant members of the population. The second challenge is about competing demands for mobile data. So there is a question about how technology providers can convince consumers to use expensive data on healthcare solutions. And so the key theme that emerged here is actually that lots of individuals have mobile phones and they do use them to access online services, but this may be used for other services, banking, social media, but not necessarily for mobile health applications. And so there are potential solutions in this space, and that ranges from mobile health applications with gamified elements, which are designed around the user consumer needs. And I think that's really important, is identifying what are the drivers of consumer behavior and how do you design a product or solution that addresses those drivers with a health element behind it, that addresses the health or global health challenge that you need. And then there's another question about, how do you make your mobile health solutions available in the local languages? And so that enables you to really access the consumer group that you are targeting. And so there are interesting perspectives on this about how do we change the approach that we've taken historically to increase the uptake of the solutions available on the marketplace. And that was a key theme that emerged, is actually, especially following COVID, there's been a huge increase and expansion of mobile health and e-health solutions within the Indian context. The challenge is getting consumers to uptake those solutions in a way that is addressing their needs and changes the historic behaviors in this space. Next slide, please. There is the double-edged sword of the cost of connectivity. And while connected healthcare services have become less and less expensive, especially if we're talking around the telemedicine, there is still within the Indian context a challenge that not all healthcare is delivered by the state. There's a mix of this private, public, and informal healthcare provision. And so there is a double-edged sword in some sense of having to pay for the data usage when using connected services, on top of as well paying for the health service that's being delivered. There are numerous potential solutions in this space. One is looking at local health connectivity hubs, where individuals from local communities or rural areas can go to a hub and use that hub to access the internet or access any wireless services to be able to improve their connection to different providers and solutions that aren't available locally. There is a potential solution around subsidized internet for healthcare purposes. And so how can we use the mobile network providers to actually, in working with government, to subsidize any applications, which are healthcare applications that can be provided to local populations and rely on the internet to be able to use. And then finally, there's a question about how can you connect insurance providers to connected services so that if patients are using those connected services, they can actually draw upon and receive a reimbursement from their insurance providers as well. And so that will really help tackle the costs of connectivity at this stage. And then finally, there's a challenge around data sharing between siloed parts of the health system and security concerns. So how can government and SMEs assure that the security of personal data through connected services to enable data sharing between states, public, private, and informal providers? And in this space, there are emerging solutions which are very much around how can you use cloud servers to be able to establish secure electronic health records for your patients. Next slide, please. Before we go into the different solutions, many of these challenges may sound familiar to colleagues living in the UK as well, because many of them are very similar to what we've got in the UK, which raises the question about how do we start tackling this in a collaborative way that draws upon the expertise across the UK and India and bridges policy, those who are shaping policy and those who are building the products. And there is a potential question or solution around, is there a challenge program that takes the challenges that we've discussed today, brings on board stakeholders from both policymakers and innovators across the UK and India to match the capabilities of different providers and come up with joint collaborative solutions across different nations. And I think this will apply as well to One Health when we talk about the challenges in that space later, but is a key challenge area with a potential solution that we're really keen on investigating further and understanding how can we best integrate the different solutions and capabilities across nations going forward to make sure that actually we're having a integrated and holistic approach to the problems that have been addressed. So we've got a few organizations who are going to showcase the solutions that address many of the challenges that I've just spoken about. So Munawar, if we go to the next slide, I'm really pleased that we're joined by Visionable, Eva Health Technologies, and Accelerate, who are now going to each speak for about 5 minutes through their solutions in this space. So I'll pass over to Visionable.
Thanks, Louis, and good morning, good afternoon, everybody. My name's David East. I'm Business Solutions Director for Visionable Global. We are a cloud-based advanced clinical collaboration solution provider that was designed and dedicated to providing support into global healthcare challenges. In this short session, what I'd like to leave a few points to sort of consider us by is some of the areas that we can support the redesign of future care pathways. In terms of innovation, so our unique patented multi-stream technology allows clinical pathways to reimagine the way that patient care is delivered. In terms of future-proofing any hybrid connectivity that is adopted within the region or the geography, our low bandwidth capability allows us to be able to support across any hybrid connectivity approach that's adopted. And the mission that Visionable have been designed for is to make healthcare equitable and accessible globally. So we're bringing the care to the patient. Next slide, please. So we talk about this isn't video, this is Visionable. And what we mean by that is the standard video providers that look at office communication or internal communications will deal with standard webinars, meeting rooms, etc. Where we play and where we've been designed is patient-centric clinical collaboration. So we look at, we've designed very simple, accessible solutions that solve complex clinical collaboration problems. We have a suite of components that look at the end-to-end patient journey and how do we ensure that clinical collaboration is effectively stimulated across that patient journey. Next slide, please. As an example of the work that we've actually done in India and globally, we performed a remote assisted surgery using our collaborator platform. Which was a thyroidectomy delivered from a London surgeon, mirrored by a surgeon in India in a small town called Chikudara, with an auditorium of surgeons in London viewing this surgery. And what we were doing is utilising that multi-stream capability to stream the live patient diagnostics as well as the camera views from the two surgeons so that we had a full 360 view of the surgery itself. This was delivered using 4G and satellite connectivity, and again, allowed us to really promote the capability around low bandwidth areas. Next slide, please. The unique patented technology that we've designed is a proprietary system, again designed for advanced collaboration across the entire patient journey, accessible on any mobile device or tablet or PC. We can bring in feeds and ingest medical technologies to ensure that all relevant and critical patient data is streamed and viewed by each party within the pathway. We've got secure encrypted technology that is scalable. It's a cloud-based solution that can be deployed in any geography. And we've developed APIs that allow us to interoperability and to integrate with any clinical system. Next slide, please. The Visionable Journey, we have been very well established in the UK health system for many years now, from fixed location, complex MDTs, to regional networks and the national prison health contract that we've been awarded for a few years now, looking at prison telehealth services around our virtual consultations and our virtual MDTs. We are currently in the stage 2 of our development around care pathway redesign. So how do we look at from prevention through to rehabilitation, looking at different components within the hospital, the home, and within the emergency services, and moving swiftly into our global expansion into virtual hospitals and a connected care ecosystem across the globe. Next slide, please. The platform, as I say, is looking at going beyond advanced video into modular clinical capability. So we've developed a suite of APIs to interoperate with many health systems, to bring in other third-party and ecosystem providers around device integration, IoT, video analytics, to make sure that the care systems that we're supporting have best-of-breed technology, with Visionable solution being the conduit to bring that together. Next slide, please. One of our recent innovative projects that we've launched is our connected emergency services solution, which has been designed predominantly to connect paramedics, ambulance technicians to any remote clinical expertise they require, to stream live patient diagnostics, data and imagery into a single 360 view for all parties to make calculated and informed clinical decisions on patient care. With our hybrid connectivity partners such as Accelerate, bringing that secure secure connectivity, we're able to then look at bringing vast amounts of data into that 360 view to ensure that the patient and their care providers throughout the solution throughout the system can gain access to the right information in real time. We have deployed this solution in the UK as well as further afield in the US, this brings the doctor to the patient to be able to deal with time critical issues. Next slide, please. Visionable have designed the components within our solutions to look at end-to-end virtual care pathway redesign, in making sure that we have different components to satisfy and support a layer in virtual care systems. So whether that be prevention through emergency medical services, right the way through to recovery, we have different components that support that entire suite. Next slide, please. The key, one of the key clinical disciplines that we've proven that care pathway design within is stroke within the UK. We've been supporting the East of England Stroke Network for over 10 years now, looking at the thrombolysis rates, looking at the door-to-needle time improvement, and making sure that the patient is directed to the right care in real time as quickly as possible. We obviously know the global struggle and challenge around stroke, so we feel that this solution and this suite of solutions is able to support this global issue. Next slide, please. And finally, the dream, the goal for Visionable is to look at ensuring that the solutions that we provide allow us to bring in the full suite of community support, not just within the health system, but further afield into GPs and pharmacies, into care homes, where we can actually start to bring in lots of remote support, remote clinical workforce. So how do we look at a global clinical system whereby we can start to share learning, we can start to share resources, look at having a 24-hour care system where resources can be shared across the globe. Next slide, please. So again, in short, the three key points to raise from a Visionable perspective is innovation. We can support the redesign and rethinking of how care is delivered globally. Future-proofing the investment that's made around any hybrid connectivity approach that's adopted, given our low latency solution. And finally, and most importantly, making sure that healthcare is equitable and accessible for everybody on the planet. Thank you for your time.
Hello, I am Maddie Phipps-Taylor and I'm from Eva Health Technologies. So I think if, good afternoon, good morning. Thank you very much for having us here today. So I don't have a story about working in India, but I think what I'd like to focus on here and bring to the discussion really is how do you, once you've got the capabilities in place to be able to deliver services or the software services particularly over the infrastructure that exists, how does that liberate and free you to deliver care services in different ways, in different contexts, in different settings? So I'm going to extrapolate maybe from our experience at Eva to sort of hypothesize about what that would look like in a context of working in the Indian system as well. So who are we? We're a friendly bunch who like the colour purple. We are a bunch of people who have a lot of deep healthcare understanding and domain expertise, over 25 years in the domain of health technology, but also with a startup mentality of making sure that you can move fast, be agile, and really look to solve problems, not just to embed legacy technologies, but really to focus on solving those problems and the new problems that we are seeing in healthcare going forward as we are more connected, and I think as we come out of the pandemic too. If we could go to the next slide, please. So what we've done in the last 12 months as part of our support for the pandemic response is to be really agile in bringing to market a solution to support, particularly in the UK, the vaccination efforts, a COVID vaccination effort. What we did is we essentially brought to market within 6 months from being a sort of a concept that NHS Digital came to us and asked for some help with, to being a live, approved, assured product in the market within 6 months. And then following that, another 6 months to scale up from 1 to over 60 primary care networks across the whole of England. So I suppose what we bring is that aspect of the startup mentality to solve a problem and to do it quickly, but reliably and safely, building on a very deep expertise of understanding what it takes to work with healthcare data and all that brings with it. A lot of what we got here, though, I mean, it'd be interesting, any of the questions that come through, is really focused on making sure that it's accessible in all settings. So this, I think, was quite a different approach for clinicians in England to take, to really think about genuinely bringing care to wherever care needed to be delivered to have the impact they needed. So whether that was in church halls, village halls, mosques, temples, buses, everywhere that they were out and about, our solution was there to support them. So in whatever setting, as long as they had a Wi-Fi or data connection. So our solution was deliberately built so that it didn't require a lot of data. It's available over the open internet without any VPNs or anything like that. A lot of the security, obviously, elements that are in the AWS aspects of our hosting. And also, we've got full constant monitoring to alert us to any potentially concerning activity that might be available, as a result of being available on the internet. But that really has opened up the opportunity space to take care out of traditional settings. And I think that's one of the things that this work that's ongoing now is really thinking about how do you build a reliable service for the future that isn't so restricted to the institutions and the physical buildings and infrastructure that has been there in the past. We can go to the next slide, please. What does it mean to be working to the Eva standard? And I think, extrapolating from some of these, you can see where we're heading as a business. This is very much, very forward thinking. What does the world need to be in the future to support health tech and to support healthcare providers to deliver what is going to be an increasingly difficult challenge to provide population health in a very globalized world. So we're cloud-based, we're on AWS, we're resilient and robust. We put a lot of effort and time into making sure that we've got excellent uptime statistics. We use modern UX and UI design so that it's intuitive and that the training burden is really minimum. We're trying to make it really easy for people to be able to pick this up. This is clinicians and administrators, rather than the traditional model of expecting people to go into a classroom setting to learn how to use the software. We're agile and iterative. We release at least every 2 weeks, if not every week. All of that is going through the assurance processes that we have to in the NHS context, and I'm sure there would be similar local processes when we talk to customers in India. Safe and secure. We consider obviously that as part of our USP, and I think it's part of also the infrastructure that we put in place, really making sure we've got failovers, resilience. We've thought about how things can fail gracefully, because that's the world in which our customers are operating, and therefore we must support them to do that. And as you say, onboarding and supporting is part of the service wrapper around our software. Next slide, please. So what would we be able to, where are we going in the UK, and what would we be able to offer internationally? Really, we see the traditional model of a very chunky software for your clinical records to be a thing of the past. And moving forward, it's going to be about where we've got here, the read-write row. You want to read what you've already got in your medical records and what other suppliers or other providers may have understand about that patient, whether it's a patient registry, whether it's a different clinic down the road, whether it's a different state that may have some information about your patient. The more information you have at the point of care, the better decisions you can make. And that's really important for all clinicians. So being able to integrate to different systems, being able to pull in data from other sources at the point of care is really important. We're seeing that in the UK, and I would extrapolate that internationally. Writing to the record, clearly that's a core part of being a medical record. You need to be able to write to the record, but also to code the record. So clinical coding is a massive industry. We've picked SNOMED as an international standard to base our platform around, although it could be a configuration that we could switch out. That understanding the quality of the coded information is really important, because computer algorithms, AI algorithms, the richer the quality, the data and the specificity that comes from the clinical coding language can really help to articulate things fast. For example, if there's a second pandemic, or another pandemic, not a second, another pandemic, how would you start to pick up the signs and the signals? What would you be looking at? In the UK, for example, there are reports out of all GP practices that are picking up the codes that are used. Mostly these are things like, flu season. When does flu season really kick off? When are you starting to see the uptick in the flu codes being put onto people's records? But you could see that from other things. If you had maybe a hyper-localized outbreak of a condition, how quickly can you see it? It's really important to have that data, and the quality of the coding is really important to pick that up fast. We're trying to make it really easy to use clinical coding in our system, and then the sort of the opportunity set that comes from that is huge. Then lastly, I'm going to focus on roaming very much as part of the theme of this particular conversation today. I see that as just going to be the table stakes going forward. We need to make sure that the systems are available wherever clinicians need and want to deliver care, and we're very much aligned to that way of thinking. I think my last slide, just one more, please. I was asked to think about what would be the localization considerations for the Indian market, and I'm sure there would be many, and it would be great to talk to people about that. My first couple, just to highlight here, so the clinical practices and language requirements. Modern software, obviously you can localize and change out language packs. That's fine. We just need to work with someone to make sure that is clinically sound and safe. But we'd also want to work through the clinical protocols to be configured in the system, very much a forms-based approach to defining a clinical protocol that can be used by different members of the care team. We very much consider that healthcare is a team sport, and that different members of the team will have different roles. They'll have different tools potentially for their roles, and to support them in our platform in a configured way that helps them to say, well, I can work to the top of my license. I can do a certain amount of things within the skill set that I have, or I can then, if it goes beyond that, I can escalate it to someone else who has a different level of permission. We'd also have to think about the national and local regulatory framework. Regulation is one of my interests. Not everyone shares that, but it is fascinating, the local nuances, and they're not to be underestimated. But really holding ourselves to a high quality bar, and making sure that we have got all the accreditations and certifications in place well ahead of obviously going live. But making sure that we've also thought very much from the patient's perspective as well, and really pushing that agenda to make sure that what the patient would expect, have a reasonable expectation of, is really delivered on, to ensure that we have that trust and we never lose patients' trust in how we handle their data. We'd look to do an integration mapping of all the existing things that you'd need to bring together. It is complex, it is a displacement market, but really understanding interoperability agenda and making sure that how those systems work, and if those systems are modern and brilliant and they've got APIs that are open and fantastic, that would be great. If not, how else do we manage that, and manage that sensitively and elegantly in a context where you might be out in the field and needing some of this information. And then lastly, obviously data hosting from a local perspective. We're AWS hosted, so we'd be using them and by a data center. I'm sure there'd be some other things we'd need to do to make sure that we are ticking all the boxes. But that was a starter for 10, and hopefully might bring up some questions. Happy to answer next.
Right, good morning or good afternoon, wherever you happen to be. Can everybody hear me all right? Good. I'm David Savage, and I'm the chairman or CEO, and actually the founder of Accelerate Technology. Probably makes me the oldest one on this webinar this morning, but that's the way it goes, folks. It's interesting because we started off with a slide that said connect your world, which kind of sums up everything we do. And this particular slide, which is a bit busy and not particularly sexy, so I apologize for that, it mentions hybrid connectivity and satellite and cellular. And it's interesting because it's almost like this is a new concept, which makes me smile quite a lot, actually, because Accelerate is now in its 21st year. And we actually introduced the use of satellite technology or satellite connectivity to the emergency services in the UK about 20 years ago, actually. And so there isn't a county in the UK where a first responder incident command unit isn't connected to satellite for resilient broadband services. And across that network, all sorts of applications run. In the very early days, it was a struggle because no one could think what kind of applications they would use, and started off with only using emails, et cetera, when they were at a major incident. And of course, now data, voice, and video is an integral part of that, with video particularly being a very, very strong driver for connectivity. And then the hybrid bit is interesting as well, because we've actually been blending satellite and cellular together for probably about 18 years. That's culminated very recently in December 2021, which was last year. So at the end of last year, we signed a contract with the European Space Agency, who are providing 5.7 million euros of funding for us to develop the next generation of hybrid connectivity as a service solution. And it's specifically aimed at UK ambulance service at the moment, or that's the kind of handle we're hanging it on at the moment. But in reality, once that's developed, and it's a 20-month program, when partway there anyway, it happens because this was something we were already involved in. But the idea will be that this will transform the ability to deploy these solutions. It will become much more simple to do, and it will become global, and there won't be actually a business sector that isn't touched by this at some point in time. Next slide, please. There's another busy slide, but our core business we describe as first responders. So we are UK based, so our headquarters is based in Cardiff in the UK, in Wales, but we have an office and business in Abu Dhabi for the UAE. We have another office in Melbourne for Australia, and we have another office in Washington, DC for the States business as well. We started off, as I said, by providing ubiquitous, uninterruptible, guaranteed, wherever it needs to be, connectivity for first responders, primarily for their major incident command vehicles, which might be used at anything from a terrorist incident. And in fairness, it's sad to say that was a big driver for our early growth. And the reason we set up the business was because we found our first responder clients were trying to manage these large scale incidents in areas where there might not be any connectivity at all, or where that connectivity is being compromised. And if not compromised, just simply it just can't handle the traffic that happens when there's a major public incident like a terrorist attack or a major crash or something like that. So first responder, command vehicles, incident command vehicles are the start of where we want to be. The growth for our market, however, is that it's fleets of vehicles now. So we are putting connectivity solutions on hundreds of ambulances, fire engines or fire appliances. So connecting fleets is a big part of what we're doing now, but also wearable technology as well, and portable technology. So if a paramedic has to leave the ambulance, if a fire officer has to leave a fire appliance and walk 200 or 300 meters away from the appliance and out of the connectivity bubble that's created within that asset, then they can take their networks with them as well. So that's an important area of what we do as well. And it's interesting, having listened to David earlier on, as you saw our logos up on Visionable's slide as well. We're a partner with Visionable because they have an application, fantastic application to bring medical care out into the field. We're very heavily involved in telemedicine applications at the moment. And there's no conflict there because what we're doing really is we're providing that part of the jigsaw, and that's how I would explain what we do really. There's a great big technological jigsaw, a lot of different pieces. In some cases, we provide all of the pieces. We may actually be the prime contractor and delivering absolutely everything in the jigsaw. Some clients might only buy one or two pieces of that jigsaw, but at the heart of the jigsaw, the center of the jigsaw, is always this issue about connectivity, because we've talked a lot, we've heard, cloud being mentioned quite a few times this morning. Fine, everything's moving to the cloud. You've got to be able to access the cloud under any circumstances, wherever you are. And there is actually no way of providing optimum resilience without satellite being part of that equation as well. On this slide as well, you'll see something there, rural connectivity in the far right there. So we were engaged with Catapult fairly recently in a 2-year project, and our work stream, we led a work stream for the connected coast aspect of that, and that culminated in us and Catapult creating, I think, the first private 5G network anywhere in the world, and that is actually the core network was hosted at one of Catapult's facilities, and it's also being driven over our satellite network as well, which we're managing. Next slide, please. Probably these visuals, this isn't theory. This is actually an actual customer of ours in Qatar. So Hamad Medical, or Hamad Corporation, are Qatar's equivalent of the NHS and the ambulance service in Qatar. We were brought in about 4 or 5 years ago when we started first talking with Hamad and Qatar government, and all of this in preparation for the Football World Cup that's happening towards the end of this year, and their emergency preparedness program for managing that large-scale event. And in that slide, there are actually 2 or 3 command vehicles in the background of that, but the vast majority of those vehicles in that slide are actually ambulances. And in the foreground is the first satellite connected ambulance. We're in the process of actually building 10 desert ambulances for Hamad Corporation as we speak. And each of those desert ambulances will have a combination of flat panel satellite antenna technology, along with 4 and 5G optimization antennas that we've provided as well. And then the hybrid connectivity bit, which is merging all of those things if you want greater speeds to carry out certain applications and video. I appreciate David said earlier on that theirs is a low bandwidth application. Not all applications are like that. Video generally is a very bandwidth hungry application, certainly compared to voice. So video is becoming a real driver for what we're doing at the moment, and that could be body-worn cameras. And one of those shots in the previous slide showed a body-worn camera, and our body-worn cameras actually stream live, because what we're giving people actually, especially in first responder markets, is real-time situational awareness. It's pointless only being able to record things which you can review after the event. Very good for training purposes, very good for evidence purposes, but it's not actually giving incident commanders or other people, real-time eyes on the event as it's actually unfolding, and that's really important. But as I say, and it's been mentioned before as well, I think if we, sounds awful, but if we can just park to one side the terrible things, the public health issues regarding COVID and some of the tragedies that have come out of that in terms of loss of life, etc. I'm pretty certain that we will look back at the COVID era as being the thing that actually was the catalyst to get on and make things happen and introduce new services and new technologies. And it's quite interesting actually that this conference call I'm doing this morning, and hopefully everybody can see and hear me very clearly. 2 years ago, I would not have been able to join this Zoom conference on video, because where I live, in fact, where I'm talking to you from now, is on the outskirts of Cheltenham in Gloucestershire in England, and I can't get fibre where I live. My cellular services are pretty poor where I live, and my ADSL is absolutely next to useless. And that was 2 years ago. And this was crazy, because I talked to my chief technical officer at the time and said, this is absolutely madness. We've sorted this problem out for hundreds of ambulances, so that no matter where they go, every application they can think of and they want to do, they will be able to carry out effectively under any circumstances with complete resilience. And yet here am I in my home running such a business, and I can't actually do this. So I am actually talking to you now on the first incarnation of our new hybrid connectivity as a service product, and I'm using a combination of Elon Musk's Starlink, LEO satellite service. I'm also using an enhanced Vodafone service. We've provided that enhancement with a product that we've actually developed, which extends the range of 4 and 5G, but it also improves the performance as well. To give you an indication, we've got some ships and some teams in oil and gas survey teams who are literally accessing and streaming live very acceptable video, something like 70 to 90 nautical miles off the coast on vessels using 4 and 5G networks that are actually on land. So our job really is to plug all of the gaps, and you know, one of the key growth areas for us is teaming up with people who've developed applications that need this connectivity, and you know, it's an interesting area to be. I think the other thing as well is probably quite controversial, but I will say it because there are other people on the call who need to know this. It's almost like we're giving the impression that the UK is ahead of all of this, and you know, India should be adopting something from the UK because we actually know it all, and that's not true at all. Certainly at the sharp end, which is where I am, it is actually surprising. It's a surprising struggle to get these ideas embraced to the level that they need to be embraced for everything we're talking about to become actually just a commonplace, even in the UK. But it will happen in time, and that's the benefit of sometimes working in the public sector. It takes a while. Anyway, there's probably not a lot more I need to say now. So there are other slides, but to be honest with you, all they're doing really is illustrating some of the things I'm talking about. Hope you found it interesting, and you know where I am. You know who I am now, and certainly replicating what we're doing in other continents, in other areas, is something that's relatively easy for us to do with the right partners. Thank you.
Thank you so much to all of our showcases there. I think that was brilliant, and it's great to see such demonstrations of innovations in this space. And as David was just saying, the importance of actually the collaboration between countries and capabilities across both countries moving forward as well is a really important theme. I'm going to pass on to Meenakshi, who will talk us through the challenges and opportunities identified in the space of One Health.
Yes, thanks, Louis. It's been a really fascinating set of presentations, and I can already see the overlaps between connectivity and the next set of challenges and solutions that we'll be talking about, which is about One Health. Just to go back to the previous slide, please. I want to say a few things about OASIS. That's the project which I lead in India. It's a very large and growing body of research and implementation work around One Health and how to optimize antibiotic use for human and animal health in community settings in India. These are settings which have very mixed health systems, with a public sector, a very large private health sector, and an even larger para-health sector that provides healthcare and also a number of antibiotics. to community, to households in rural communities. And many of you, I'm sure, recognize that there are many a step between the introduction of a technology solution and its ultimate integration, and the health system and health policy readiness for that. So that's where I think Oasis is making a difference. Our work has been trying to harness very extensive stakeholder engagement in India from across different sectors, from where the oppositions might come, where there are turf protection issues, conflicts of interest, health policy barriers. We are trying to address all those through stakeholder engagement to co-design strategies. And digital interventions are going to play a very important role in this sector for us. So just giving you that background about my work, let's talk about the One Health issue and its challenges. So can we move to the next slide? Yeah, that one. Now, the One Health term, as many of you might understand, One Health emphasizes the interconnectedness between the health across different species, that's human health, animal health, and also health of the environment. And that is what makes it truly global, because when we talk about disease-causing pathogens, when we talk about diseases, they can actually travel across borders. They don't need visas like many of us do. And this is also what makes this a collective responsibility, a collaborative responsibility. It's up to all of us to protect not just ourselves, but all the others on this planet. One Health is extremely relevant to India because it's one of the highest AMR countries in the world. And it also has one of the highest AMR attributable burden of deaths due to AMR diseases, which means that a large number of pathogens have become resistant to the first line of antibiotics. And this is leading to multi-drug resistant diseases and pathogens. There is also a very large rural population in India, almost 70%. And there's a lot of backyard farming for domestic consumption and for income supplementation of families, which means that people live in very close contact with animals. This increases the risk of zoonotic disease transmission. These are diseases which transmit from animals to humans, and they risk human lives as well as animal lives. And there's also a risk to food security and safety. There is a huge role of space. I don't have the words to describe all that, but I have seen some very interesting presentations that have made use of a variety of different big data sets, layered to provide very useful cross-sectoral data, which can be analyzed for all purposes, for making predictions, for doing modeling about diseases, for seeing how AMR is changing across different regions, etc. Next slide, please. I'm going to, as Louis explained, we had a workshop with several partners in India to discuss the challenges in this field, in the field of One Health, and before that in the field of connectivity. So you've already heard about the connectivity issues. These are about the One Health issues. Starting with the challenge of population health management. Now, India has a very large population, as you know. It's a population of 1.3 billion. How do we even begin to address the most urgent health needs in this population? And how can this population be protected against future outbreaks like COVID, for example, or like increasing drug-resistant infections, for example? How can we be protected against environmental threats? Some of the solutions that could provide answers, and these are just some ideas we're putting out there to stimulate thinking. There could be many more, of course. Can there be efficient and early warning systems, like through spatial apps, which can help us better prepare for emergency responses. Then the next set of challenges is around data capture to understand behaviors. How can data best be captured from everywhere, particularly from the hardest to reach areas across different sectors, animal sectors, environmental sectors, pharmaceutical effluent, hotspots? How can all this data be captured to integrate into national data sets? So that's a very big challenge that people talked about. The possible solutions could be consensual platforms and devices for tracking people as well as their health problems. And I can immediately think of some of these devices being quite effective, say for pregnant women or even for animals to track their wellness and health status. Next, please. Yes, so this is the next set of challenges which was identified. Continuing on the same note of data integration across different sectors, we need very efficient data integration platforms that start from personalized health advice and links with national data set to, and also for emerging conditions like COVID. We need to integrate these with national and international data sets. And COVID is the best example, I think, that highlights the need for collaboration across information, across data, and across a sense of solidarity across different countries. And then what is really important is increasing access for target populations, which are quite neglected, but they happen to form about 50% of the population in low and middle income countries. I'm talking about rural communities that are quite isolated in terms of healthcare access. They are disconnected from central government policies, and they are largely, these are the ones which are most disadvantaged and the ones that we must keep at the forefront when we design technology solutions, because this is where the real challenge lies. And unless we can do something about this, we're only going to be scratching the surface, improving things where they're already good. And I think one of the potential solutions for this space is definitely mobile health consumer applications, because of the ubiquitous availability of mobile phones and increasingly smartphones now. So that's what we are going to be looking at in the next few years in our work in OASIS. Next slide, please. Then there is, of course, the whole issue of accountability for both governance and for funding. With so much fragmentation across sectors, across the human and the animal sectors, across public and private health sectors, who is going to govern this whole issue, this whole One Health space that we are so interested in? How is it going to be funded? How can national and international organizations best collaborate in a bottom-up way, not in a top-down way, but in a way that we can match our capabilities, identify our complementarities to strengthen One Health programs and solutions? I really liked what some of you, David and Maddie and all, spoke earlier about the problems in the UK as well, but there are a lot of strengths as well. Same is the case in India. There are a lot of startups, there are a lot of passionate people driven to improve health for the most disadvantaged. How can we come together and devise really good solutions? And from my experience in OASIS, I can tell you that potential solutions to create more readiness and acceptance for solutions is to engage with different stakeholders through what are called innovation and policy labs, which bring together a whole variety of stakeholders like policymakers, innovators, regulators, industry, etc., to brainstorm and come up with collaborative strategies. So I think that is my last slide. Can we move over to the next one, please? Yes, Yes. So with that, I'm going to hand you over to the next set of companies that will showcase their potential solutions to you. And thanks a lot for listening. Over to Spatial Apps.
Okay, look, hi, my name is Rob Curry, and I'm the co-owner and co-founder of a company called Spatial Apps in the UK. I want to give you a couple of minutes history about the company and then talk a little bit about some technology that we've been developing over the last 18 months to 2 years, obviously related to pandemics. So we've got a company actually headquartered in Australia. It's coming into its 20th year. We're very much focused on location intelligence. And so we have a philosophy that everything happens somewhere and it happens there for a reason. It doesn't happen randomly. And so where things happen and why things happen is really the fundamental premise that we look to try and solve. Now, whether it's a biosecurity or a health issue, we look at integrating lots and lots of data together. And I'm going to show you a few slides about a system that we've worked on just recently to look at early disease detection. This was actually initiated out of a gravity challenge, an international challenge by Deloitte, looking for technology that's going to better prepare us for the next pandemic. We need to be better prepared. So in actual fact, we're not looking at stopping the next pandemic. It's almost impossible. But if we can be prepared for it, then we can actually certainly reduce the impact. And in investigating diseases generally over the last 300 to 400 years, in actual fact, there were some very common themes. And I'm going to go through the development of the system, and it's a live system which is operating at the moment, and explain some of the facets of it and how it actually fits under this One Health paradigm. So next slide, please. Next one after this one. Really, an early pandemic warning system, or our early pandemic warning system, which we use the acronym PEWS, is really just as a support system. It uses lots and lots of data, as much data as you can possibly harvest, and looks at putting that on a map, on a spatial reference. And we use a lot of artificial intelligence and machine learning to do that. And we actually search either structured or unstructured data. So it could be a health system, or it could be newsfeed, or it could be social media. And once again, it's very relevant for India, as we've already heard, because of the ubiquitous use of mobile phones. People are using and communicating with each other very regularly through social media. And so what the system does is it looks at what people are talking about. And I'll go into a little bit more detail about how we actually harvest that information and then make sense out of it. So could I have the next slide, please? So if you look at what we collect, as I said, we collect lots and lots of information. It's actually on a secure cloud server, and we read information with a natural language processing algorithm that we developed. And we look for where people are talking about not necessarily diseases, but disease symptoms. So in some of our research over history and looking at why are we so slow sometimes in responding to epidemics and pandemics, it was quite often, we'll go out in the field and we'll do blood tests of everything from bats to monkeys to people looking for a particular disease. And quite often that's misdiagnosed for the first couple of weeks. And so we thought, well, let's take a step back and see where people are talking about disease symptoms. And these symptoms can be quite common, such as a fever and a cough and whatever. And let's see whether we can actually put that on a map. And so we harvest this information and we put it on a map. We look for hotspots where lots of people are talking about the same sort of symptoms. So that's really just the first phase of what we're doing. And we found by those heat maps that we're generating, there's an example here, then we can then start focusing our attention geographically on certain areas. And as has already been mentioned, we're living in a global world. We don't just look at one country or one region. We have to actually look at the globe, because even with a disease, if something is happening in West Africa or in Southeast Asia, within 24 hours, you can be on the other side of the world, taking that disease with you. So previously, when we weren't as well connected, when our transport vectors weren't as effective, we couldn't just jump on a plane or a boat, and disease didn't spread as quickly as they are today. And I'll tell you how we're addressing that issue as well. But here's an example of where we've actually harvested a lot of information, looked at where sentiment or people are talking about certain disease symptoms, and then we can start filtering and say, well, what are the top 5 or what are the top 10 or 20 most important disease symptoms people are talking about? And I'll explain how this comes into this One Health paradigm and also AMR a little bit later on. If I can have the next slide, please. In this particular scenario, we're actually just harvesting information over India, and we're looking for only the top 5 most important issues that people were thinking as far as health was concerned. This doesn't necessarily mean that there is going to be a problem in any one of these locations. What this then does is a decision support system may send an alert to a health expert, and the health expert then can look at other data that we integrate in the system, which I'll explain next, but then make a decision about whether they need to react, whether they need to bring in other data feeds, whether they need to do something, or just monitor it. The system automatically monitors certain issues, and it can actually send you an alert. But if you looked at a time series of what was happening, for example, over India or Southeast Asia or any part of the world, these heat maps actually grow and they fade away. They grow and they fade away. As people are talking about a cold, for example, and it might be a winter period. Well, quite often that's quite typical over winter. What we're concerned about is when they start to grow, and continue to grow, and are persistent. And the system does that for you. I'll go to the next slide, please. Go to the next slide, please. I will keep going. This is just, I want to get to the, I'm conscious of time, so keep, yep. So as we've already heard, genomic is so important. As part of this system, what we do is we look at people's sentiment, and newspapers are saying about disease and disease symptoms. But we know that these hotspots are geographically located. So what are the other spatial or the One Health issues that are actually bringing this all into effect, or maybe affecting some of these hotspots? So the wonderful use of space is demonstrated here. We can actually use satellite technology to look historically over land use change. And there's an example here of deforestation and urban expansion. Well, do we get hotspots in that interfringe between? And yet quite often we do. This is an dynamic effect of where people are pushing out more into the forest areas which were previously forested. The other thing we can look at with space and other technologies is urban sprawl. We know urban cities are growing at an incredible rate, not just in India, but globally. We know that has an effect on AMR, for example, as well. So once again, if we start looking at these changes that either human-induced or natural-induced, such as climate change, we start looking at these hotspots, is there a relationship? So I'll go to the next slide, please. Quite often there is a relationship, but the problem is because we live in a global society, and I mentioned already the transport vectors and mobility of humans, we may have a hotspot in one part of the world that can be transferred very, very quickly to another part of the world. So when we look at health issues, we actually look at the global picture. It's very important to look at the global picture because, as I said, you can be from one part of the world to another within 24 hours on a plane, or even with a boat. Here, for example, is vessel traffic. Now, the wonderful thing about space, once again, is we can actually track vessels in real time. We can detect now, about 250, 260,000 vessels globally in where they are in real time, thanks to satellite technology. We can track planes now in real time. We can also track vehicles because of GPS. So whilst it's a problem for us that these diseases can be transmitted quite quickly, we also have the technology to be able to track it and therefore prepare ourselves for potential problems. Next slide, please. Okay, One Health, how does this all come together? So if we use our pandemic early warning system, harvesting information about disease symptoms and then putting it on a map and looking for hotspots, that doesn't necessarily mean it's going to be a problem. But as I said, nothing happens randomly. So we're affected very, very much, and disease is affected very much because of the environment we live in. So in our system, we actually bring into the system what we're calling an eco stack. And it's called an eco stack for ecological reasons, but it's not just the natural environment, it's the human environment, it's everything that's happening, it's climate, it's everything that's happening around us, which can affect disease and the spread of disease. So once you bring in these layers of information that may affect a hotspot turning into a problem, you can then actually filter these hotspots of disease symptoms to be something of significance. A really good example could be a feedlot, and this relates to antimicrobial resistance as well. We know in some feedlots that we're feeding the cattle or the sheep or the animals antibiotics. We know that's going to affect the humans living around that as well. So if we mapped all those and we had a hotspot of disease symptoms appearing, clearly that's going to have more significance than if it wasn't next to a feedlot. We actually use the system to see whether we could actually find an early detection of Omicron in South Africa. And in actual fact, the system sent us an alert about 2 days before the media actually started telling everybody. We didn't know it was Omicron at the time. The system just sent us an alert that something serious was going on. So these spatial layers, if you like, geographic layers are very, very important. And they are dynamic, they're constantly changing. For example, weather is changing all the time, vegetation is changing all the time, and that's where we use the space technology to update these spatial layers. So I'll go to the next layer, please. Next slide. Now, I'm not an epidemiologist or a health expert, I'm actually a data scientist. And so when we look at data and data points, we look at them quite objectively. But having said that, the system is really designed for the input of a health expert. And certainly, health experts in India would have a much better understanding of the significance of a feedlot or a zoonomic effect than I would for their particular country. And so we have a tool in the system where you can actually weight these different spatial layers. So obviously, if there's a wet market close to a disease outbreak, you'd rate that quite highly. And the end result is what comes out as an alert or a warning for you. But the wonderful thing about this weighting system is you can then start modeling things. You could say, well, what if climate change or extra rainfall or the monsoon was lasting longer? What impact is that going to have on disease symptoms? And so not only are you looking at now, you can go historically and say, well, what if things are changing? What if we continue to expand urban into the rural areas and cut down trees? Or what if agriculture is changing its patterns in a certain way? How does that now affect our disease detection systems? So this is actually built into the system, but this is really where you need the health expert to input. The next slide. So just in summary, the World Health Organization themselves, 60% of initial outbreaks are first reported in unofficial sources. And so we took that literally. And so we said, well, let's look at all the unofficial sources. The system can harvest about 1.2, 1.3 million pieces of information every hour. And the way it works is we use AI and machine learning and natural language processing to read those pieces of information and build databases on those pieces of information that then allows us to interrogate it. But what it's looking for is where people are talking about these symptoms. We also use official sources as well, but it's more important that we try and get it before it's gone to that official source. The benefit of One Health is so important with satellite technology, where we can update these spatial layers to see what impact going forward or historically they've had on disease symptoms. And so the Pew system that we've developed is a secure cloud system. It's a SaaS model, and it can work across very thin bandwidths, but more importantly, it has an ingest model. So I call it a collaboration tool, because you can actually take your own data and actually put it through the system to see what results that has on the output. And I think I might stop there in actual fact. And so thank you very much for your time.
Hello, everyone. My name is Darshana Chauhan. I am the founder of CoPlug. We are a SaaS business having a location power decision-making product, which we are currently operating in UK, but we've also had pilots in India and Africa as well. A little bit about myself. I was born and brought up in India. I've been working in the UK and I founded the company in the UK for the last 15 years. We are in the space of spatial analytics, everything to do with city planning, but also looking at services and infrastructure planning as a key area of interest. Next slide, please. Brilliant. So our product is called SIDEM Systems. SIDEM stands for Services and Infrastructure Demand Management. Much of our work is geospatial, data-driven, and location-based analytics. Our system essentially transforms data across various sectors to provide targeted decision-makings for government and service providers. We've received previously 2 Innovate UK grants, very much in that area of research and collaborative working. We've also been awarded and recognized by Connected Places Catapult in the UK as the top 8 plan tech products, and also supported by the Mayor of London Tech Invest program. Next slide, please. So SIDEM Systems essentially allows us to pull together data from across multiple sectors into a very powerful geospatial data model. On top of the data model, we then have built in industry-tested algorithms and a very powerful business layer in collaboration with government organizations as well as the private sector to really provide dynamic, location-based actionable insights and as direct answers to very complex questions. Next slide, please. So what do we do in SEDEM systems? We provide location-based analytics capabilities. We are essentially providing some very direct answers to complex questions, such as where are the range of services and infrastructure within cities and towns? Who is that demographic who's actually using those services? What is the space and workforce capacity within those services? Where is demand coming forward on ground? What would be the impact of new demand and growth in population on our services? And finally, how much would it cost to actually deliver that change on ground as well? So these questions are quite relevant across various sectors, but we really try to focus on healthcare as our first domain area. So next slide, please. So within SEDEM systems, SEDEM Health is our first product vertical. Our first product vertical is designed to support healthcare infrastructure planning and population health management. Within that, we have 3 particular modules that really bring together the story of how do you get from understanding of where does demand happen, but also starting with where are various healthcare infrastructure facilities on ground across primary, acute, mental health, etc. Who is that demographic who's actually using those services? So all of that is happening within our area profiles module. Much of the questions that are being answered and the various clients we are working with are using our area profiles module to support population segmentation, which is then used to support commissioning of healthcare services. We also have another module in our product called estates planning, and very much to do with focused currently on healthcare estates planning. We are currently working with multiple hospital trusts within the UK to provide demand and capacity modeling for healthcare trusts. On top of it, we also do predictive analytics of where would be demand coming forward for individual GP practices. So currently we are providing projections for about 200 GP practices in Northeast London, linked to where housing data and demand is going to come forward in the next 10 to 15 years. Also trying really looking at very data-driven analytics capabilities to provide scenario planning to support a very important what-if questions of asset management of healthcare services to provide evidence base towards business cases and funding required to really understand how do we use our limited funding and focus and target our decision-making on where exactly they might be needed and in what period of time. So that happens within our estates planning module in a very geospatial environment and easy to consume data and analytics across various stakeholders. We also provide demand and cost estimation in our product. The demand and cost estimation module has been collaboratively developed with the NHS Healthy Urban Development Unit within London. Much of that demand cost estimation is really used to understand quantifying the demand of new housing and growth and that its direct impact on various healthcare settings, including primary, secondary, mental health, and intermediate settings. The extension of this module currently has been actively used to calculate tariffs of contributions from property developers towards healthcare infrastructure. So it's really looking at that ecosystem of understanding your population demand, but as well as how do you actually get to fund that kind of demand on ground linked to growth. Most importantly, our platform is a very collaborative platform, which is enabling governments such as local stakeholders, including local government organizations, healthcare providers, as well as property developers to work together in a very collaborative fashion. And the key example to this is we are just rolling out our platform across 25 government departments in Surrey Heartlands ICS, which includes 11 local authorities, mental health providers, acute trusts within that area, as well as primary care estate planners. So that really brings together the analytics capabilities of our work, the geospatial aspect of our work, but also the idea that a platform, a data analytics platform, is best consumed as a collaborative platform to really answer some very complex questions that exist on ground. Next slide, please. So yes, we have done work in India before. I personally have more experience, even as from a consultancy basis as well, in actually operating in India in various settings within government as well as private sector. So one of the projects that we had been looked at as a pilot project was funded by DFID at the time. We were working very closely with the Ranchi and Bhubaneswar, Jharkhand state area, to look at capacity building within government organizations. So how can spatial analytics platforms be used as easy to use, user-friendly models and tools to enable capacity building within local governments? So SIDEM systems has been used as a pilot to enable that kind of collaborative working, as well as capacity building models that can be used across various stakeholders. Next slide, please. We've also done some really exciting work in India from funded within by our company. We've worked across 40 different colleges and universities all across India in order to crowdsource spatial data across 40 cities regards to open spaces as well as determinants of health. We are quite aware of the data maturity that might exist, particularly in the spatial data aspect, but also data across healthcare. We believe that we can also extend and apply the capability of our platform to crowdsource information from various areas, especially in order to fill those data gaps to then be able to provide actionable insights. So we very much believe in upskilling, capacity building, but also using the power of data and analytics to really provide answers to very complex questions in a localized setting as well as strategic setting. Finally, I would like to say that we are very keen to use our collaborative approach to working and developing our product, working across not just healthcare, but also local government, as well as planning and geospatial departments, to really pull together that overall understanding of One Health, also looking at cross-sector working from demographics and geospatial analytics, and linking that to healthcare and patient level data, as well as healthcare providers, to bring that holistic approach of how you can put together various decision-making powers in the hands of various stakeholders and provide that common platform to make targeted decision-making and accelerate them on ground. Thank you very much.
Hello, everybody, and thank you for the invitation to share our story today, and to Rahul for the mention earlier. I'm Bruce Adams, Sales Director at Spirit Health, and I'm here today to share with you the story of Clinitouch V, our remote monitoring digital health platform that's being used at scale in the UK as part of the digital healthcare transformation agenda. So next slide, please. So Spirit Health, founded in 2009, based in Leicester in the UK. We're one of the fastest growing healthcare providers in the UK with huge aspirational plans globally. As a team, we genuinely care about patients and people, and we have one goal, which is to make health easy for everyone. So how do we do this? We implement medicines optimization services and prescribing programs. We deliver primary care to over 100,000 patients through our GP surgeries. We dispense NHS prescriptions through our online diabetes-focused pharmacy. We provide diabetes education and pulmonary rehab services to thousands of patients each year. And then finally, as I'm here to talk to you about today, we deliver innovative remote monitoring and virtual ward solutions for people with long-term health conditions across multiple NHS areas via our multi-award-winning Clinitouch V software platform. With a solid foundation in the UK, we're in the process of launching into our first international territory in Ireland. We've identified a pilot site in the US and are actively seeking partners to deliver the proven outcomes in further overseas territories. Next slide, please. And here on the screen, you'll see some of the partners that we work with. Note the European Space Agency, which I'll come on to a little bit later, and some of the 8 awards that Clinitouch V has won over the last 3 years. Next slide, please. So the problems we all know, aging populations with comorbidities and capacity issues with the current hospital-centric healthcare models that have only been heightened by the COVID-19 pandemic. Next slide, please. So how and why is Clinitouch V part of the solution to these problems? So Clinitouch V as a remote monitoring virtual ward platform improves workforce and system capacity and improves patient outcomes. Patients can be discharged from hospital quicker, proactively monitored in the community, and priority-based interventions made to prevent readmission to hospital. We have over 10 years of published peer-reviewed research that evidences the positive outcomes, and I've got a little slide on that a little bit later. Next slide, please. So how does it work? So patients complete daily question sets with a mixture of soft questions such as how do you feel today compared to yesterday, much better, much worse, the same. And these are mixed with key health metric data, which depend on their conditions, which is dependent on their conditional conditions and taken through medical devices and based upon local requirements. These health metrics can be manually entered or pulled into the platform from health monitoring devices via Bluetooth. Coupled with that, then education within the system supports patients to self-manage their conditions. Clinitouch V then uses a unique algorithm set to generate a RAG-rated risk score that flags to the clinicians where care or intervention is most needed. Clinicians can then do video consultations through the platform or send messages to patients. Data can then equally, through our open API, can be fed into compatible and complementary systems, and we already do this within the NHS. Next slide, please. So Clinitouch, as we've seen with a few systems today, is really simple, easy to use and accessible via any internet connected device, which we've designed in such a way to break down the barriers to people who are not overly IT confident. And in fact, we're pretty proud to say that our oldest patient has been over 100 years old who's used Clinitouch V to manage their long-term condition in the community. Next slide, please. So the Clinitouch V platform is condition agnostic and can be set up to monitor any condition within the community. We've had significant success with the pathways that you can see listed on the screen there. And we work with a variety of care providers from both the health and social care sectors. Next slide, please. So as I mentioned, we're really proud that our work and technology is evidence-based, with published and peer-reviewed research demonstrating cost savings to the NHS, system efficiencies, and most important of all, improved patient outcomes, as you can see on the screen there. Next slide, please. But in all honesty, it's the human stories that matter, and we hear them day in, day out of the impact that remote monitoring and Clinitouch V makes in both people's lives and clinicians and practitioners' lives. Next slide, please. We're really proud of is our partnership with the European Space Agency, who worked with Spirit to provide satellite fed live street by street air quality pollution information respiratory patients delivered through Clinitouch V, which has transformed exercise regimes and improved people's quality of life. The next phase of our partnership is the Healthcare and Space project that funding has just been applied for, which will research and deliver remote monitoring of astronauts' health in space in preparation for future lunar landings and lunar bases via a mixture of leading medical devices and Clinitouch V as a remote monitoring platform. Now that's a really hugely exciting project for us to be involved in, and let's face it, space is pretty cool, and my 4-year-old son loves the fact that his dad's working on a space project. Next slide, please. So to finish, we see India in particular as a hugely exciting market for clean touch V, and a country that has huge potential to realise the significant outcomes and benefits that we know exist with our technology. We're currently part of the Global Business Innovation Programme in India through Innovate UK, and are hugely excited by the National Digital Health Mission launched in India in 2021. We're absolutely 100% a collaborative company at heart, and we value others' expertise. So we are genuinely actively seeking partners to join our reseller program that share our passion, values and mission to make healthcare easy and improve lives. Next slide, please. So all that's left for me to say is thank you for your time today. Please feel free to reach out. My contact details are here, and I wish you all a thoroughly fantastic, if not a bit windy, weekend when it finally arrives. Thank you.
Thank you, Bruce. And thank you to all of our speakers and for all of you for staying on, conscious of time. So I'll quickly whistle through our conclusions and next steps for you all, just so you're aware of what we're doing going forward. So now that we've done this bilateral event, we're going to be completing a roadmap for our report, which we're delivering to Innovate UK, UKRI, FCDO. And in that report, we'll include feedback from today. So it's very important that you all fill in the post-event survey that'll be coming out either today or at the start of next week. We're going to be providing some conclusions and recommendations, and obviously we want those to be tangible and proactive. We don't want this just to be another bilateral event or another event that you all sit in and listen to, but there's no actual consequence of it. So in your feedback, please do make recommendations, suggestions as to things that you would like to see happen. And finally, we'll be producing a blog post after this as well, which will have the recording embedded, as well as any questions from the Q&A and chat session today, and slides can be made available on request. Next slide, please, Manuel. So with that, I'll just say, as I said, thank you to all our speakers and for staying on. We'll stop the recording in a moment, but we'll keep the chat open for another 5-ish minutes if you want to type in any questions for us to respond, and we'll answer those in our blog. So thank you very much for staying on. Have a terrific afternoon. Enjoy your weekend. Bye now.